Morning.
Come on in. Morning. When you're in pain, it controls all your thoughts.
Over a decade ago, when he was aged just 29, Richard developed chronic pain. He dealt with it for a number of years before he found medical cannabis. Since then, he says his life has changed.
When you're in pain, that's all you can think about. That's it. When you wake up, you're in pain. But medical cannabis just gives you that break. And not just physically, mentally, it gives you a mental break.
After the chronic pain began, unable to function as he once had, Richard was forced to close his barber shop. But with the help of medical cannabis, he says he was able to reopen a new shop at his home.
Medical cannabis, it gives you that life back. It gives you that little bit of strength, a little bit of, even if it's for an hour, it's like you've got yourself back for 1 hour. And that, in 10 years, for having pain for 10 years, is amazing.
For Richard, his life is now back on track. However, as a relatively new product on the market, many would perhaps be sceptical about how medical cannabis actually works.
Cannabis is one of the only medicines which is able to communicate and interact with a person's endocannabinoid system to help alleviate various issues such as appetite, sleep, mood, and that is effectively how medical cannabis is able to benefit various conditions.
There are now an estimated 35 to 40,000 patients in the UK being prescribed medical cannabis, with research showing it has the power to improve a patient's quality of life by over 50%.
Quite a lot of our patients are feeding back that medical cannabis has been life-changing for them. They don't have the side effects. They feel much better. They're able to get on with their everyday lives.
Medical cannabis was legalised here in the UK back in 2018, and with Mar Medica reporting a 1,250% increase to their number of patients since the start of last year, could the public's perception of this drug be shifting?
I think it'd be preferable to using like a harsher intervention. As far as I know, it just seems more natural to me.
Personally, I would, because I've just heard a lot about like the benefits.
I would, but I'd be scared, well, not so concerned whether or not I get dependent on it at all.
I wouldn't myself, but for somebody who's in a great deal of pain, I think it's probably good.
If it's prescribed by the doctor and under medical supervision, yeah, I'd definitely use it. And I think that's how it should be used.
Just over 5 years ago, the use of medical cannabis would have been seen as a criminal offence. But now, as times continue to change, it seems that what was once taboo is now becoming the tried and tested. Sophie Reaper, GB News.